Hello, everybody. Good afternoon. Welcome to the next of our Essential series. These are topical, engaging, and educational webinars on wealth and wellness by leaders in the private client and wellness world. I'm really delighted to invite Dr. Shadi, cosmetic dentist and founder of Smart Dental, to explore the hidden link between oral health and fertility. So I'm going to get her on, and she's going to share some practical tips on how to protect your oral and reproductive health, and also explore this very niche but very important subject in more detail. I'm just going to get her on. Hello, good afternoon. How are you?
Hello, I'm very well, thank you. How are you?
Yes, good. All the better for seeing you. So before we get more into the topic, could we have a little bit more of an understanding of who you are and what you do?
Of course, yeah. So my name is Shadi Mancheri. I've been a dentist now for almost 10 years now, and I've spent some time working in NHS hospitals in head and neck surgery before going into private practice where I am now. My clinical work involves a range of cosmetic dentistry, routine dentistry, as well as facial aesthetics. Which is very important to me. I'm also the director at the London School of Facial Aesthetics, where we teach doctors and dentists how to do aesthetic procedures. And I'm also the founder of Smart Dental and Aesthetics Clinic in Marylebone, which is an all-round holistic clinic that looks at overall health, dentistry, and facial aesthetics.
Amazing. One-stop shop to make everything just a little bit better. And I have actually been to the clinic, and it is a beautiful setting as well. It's not like, I think a lot of people have this fear of the dentist. I don't know why. Do you know any of the reason? Like, is there a psychological reason why
For
we should?
most people, honestly, I think it's childhood experiences. Most people that have phobias or anxieties around dentistry have usually had a really bad experience in their childhood, and dentistry has come a long way in that. I think it's quite trendy and glamorous now. Everyone knows about Invisalign and composite bonding, but I think even 5-10 years ago, it wasn't like that. So most people will associate dentistry with pain because often they will go when they're in pain. They will often also have, I think, a very stereotypical image of what a dentist should look like, how they should behave, how a clinic looks. So as I explained to you as well, we did everything from scratch in the clinic. So I designed everything, and my main priority was that the reception area and even the clinical rooms, I didn't want them to look or smell clinical. So I wanted people to feel like they'd come to, like a luxury hotel or a salon, anything but clinical, because I think some of the old school clinics that you'll go to, there's a very distinctive look to the furniture, to the waiting room, to the clinical rooms. There's a very strange antiseptic scent that I really don't like. So with the clinic, we were pretty adamant that we didn't want any of that here, and I'm glad it comes across because most people comment on it because it puts you at ease and you're less anxious. And then we usually ease people who are phobic or have anxieties bit by bit into sort of clinical treatment if they need it.
Yeah, well, exactly. And you do have a very good bedside manner as well, which is helpful because it's a very intimate, relationship you have with your client when you get your hands in their mouth a lot of the time.
It is. And honestly, it's a very strange profession where you work this hard, and the first thing people say to you, even before they've got to know you, is no offense, but I hate the dentist. And it's up to us to try and make them at least they're not even coming in at a neutral position, they're coming in a very negative, and you have to bring them up to the neutral and hopefully eventually a positive experience. And that takes a lot of hard work.
Well, if anyone can do it, you can do it. So, let's just talk a bit about oral health and fertility. I hadn't even thought about this as being a thing, but clearly that really does make sense now that you've highlighted it. So tell us a bit more.
So I feel like this is a very on-trend topic, and I'm glad we're talking about it. But the link between oral health and overall health has been long-standing. We know that oral health is very closely connected to certain conditions affecting the overall health, such as diabetes, cardiovascular disease, and other inflammatory conditions in the body, some gastric issues like ulcerative colitis. And this has been long-standing and established, and we've known about it and we talk about it. And usually there is a bi-directional link. So, for example, the diabetes might make the oral health worse and vice versa. So treating one can often improve the other. The link with oral health and fertility is a relatively new subject that we're talking about and we're interested in and we're researching. and it can affect men and women, as I'm sure we'll get into it. And you know, the current climate when it comes to fertility has changed a lot. People are a lot more aware. People are usually, you know, there's more people having children a bit later on because of lots of different factors. Finances, careers, lots of these things, IVF, people going through IVF. So there is a lot of new knowledge around fertility in general, and I'm glad that we're now talking about the links with things like oral health and how maintaining your oral health and looking after it can actually improve your chances of conceiving and even help reduce the complications you may experience during pregnancy.
Amazing. Well, I think that's what any new parent wants to wants to do. So let's dive into that a bit more. Maybe how does and we touched on how does it affect men and women differently? Because I would think, being me, you know, the mouth is going to have the same microbiome. Or do you get microbiome in the mouth?
We do, yes. Again, it's a very trendy, hot topic at the moment, the oral microbiome that everyone's talking about.
Yeah. Okay. So as men and women, do we have different microbiome in our mouths?
We do, yeah. Every single individual has different microbiomes in their mouth. And bacteria in the mouth can travel elsewhere in the body. So the bacterial makeup during health and during disease is very, very different. So we all have good bacteria and bad bacteria everywhere in our bodies. And usually when there's an infection or a disease going on, it's a case where the bad bacteria or the pathogenic bacteria have usually overtaken the good bacteria. So that balance is disturbed. And they found that actually the bad bacteria that exists in the mouth with inflammatory conditions such as gum disease or periodontitis can actually travel elsewhere in the body. And it can affect you in two different ways. It can be the bacteria itself that can affect your reproductive system. And again, it could be in the men and women. And there is some research to show that, for example, women who experience preterm labor, they had a specific bacteria that exists in the mouth that they found in the placenta or the amniotic fluid. And in men, they found that actually having gum disease or active infection of the supporting structures of the mouth can affect the quality of the sperm, its motility, and it can even increase their risks of having an infection in the semen, which can obviously affect their success with conceiving.
Yeah. Fascinating. I didn't even know that semen could get an infection. I'm learning so many things.
Another way that it can affect actually, one way is directly the bacteria. The second way is the inflammatory condition that it elicits in the mouth. So that inflammatory condition will release inflammatory markers that can affect the rest of the body as well, including the reproductive system.
Gosh, that's and what would then be different, say, for women if that was a bit more on the men's side? What might this look like for a woman?
So for women, there is a link shown with inflammatory conditions in the mouth and things like endometriosis and PCOS. And generally, people who are going through this journey, if they're having difficulty conceiving, usually their doctors will put them on a healthy lifestyle. You know, reduce smoking, reduce risking, exercise, nutrient-rich diet. And oral health is now becoming an integral part of that as well. Because there's no point you looking after all these parts of your overall health when your oral health isn't quite up to scratch. And it can be quite simple to maintain your oral health. You know, regular dental cleans, seeing the dentist regularly to identify any signs of infection. But anything untoward going on in the mouth will basically travel elsewhere in the body. And they've actually shown that there's some research to show that the oral bacteria that exists in disease can triple the risk of infertility in women. Now, that's quite alarming statistics.
That's a lot.
But that's what the new research is suggesting.
Gosh, and so what might the signs be if there were an infection or something like that?
So it can be something as simple as bleeding gums. So in the mouth, it could be, so you may have heard of gingivitis. Gingivitis is a very common inflammatory condition of the mouth. It affects a lot of people. And it is the early or reversible stage of gum disease. And the early signs can be literally just bleeding gums. So occasionally when you brush or floss your teeth, you will have bleeding gums. A lot of people might experience this and a lot of people might ignore this, which they shouldn't, because this can progress to long-standing infection of the gum or periodontal disease. Now, in the early stages, this can be reversed. If you see your dentist and you have a dental clean to get rid of what's causing the gum disease or the gingivitis, this can reverse it. But if you don't treat it, it can affect the deeper or the supporting structures of the teeth, and it can even affect your jawbone.
Ooh, okay. And that's quite serious when it gets to that stage, isn't it?
It is, because it's irreversible. So even if you stop it at that stage, you still can't reverse the damage that's been done. So that's
So,
why early diagnosis and treatment is very, very important.
and that's where you'd have to have like some of your jaw cut out or something, is it?
Hopefully not. Usually the early stages. So some signs, like we said, it could be just as easy as bleeding gums. In the advanced stages, it could be bad breath, it could be abscesses on the gum, it can be really tender or swollen gums. It can be bleeding when it's unprovoked, so people can wake up with blood on their pillow if it's advanced gum disease.
Wow.
Treatment would usually involve cleaning the supporting structures of the teeth. So doing really deep clean around the gums and mouth, and usually eliminating any factors that might be causing it. So smoking is a big risk factor.
Mm-hmm.
And cutting down or stopping altogether can actually go a long way in improving your gum disease.
Okay, well, yes, note that, everybody. So, okay, if people have sensitive teeth, though, what do they mean by that? I'm just
So
thinking about.
sensitivity is usually when you have something cold or something hot. It
Mm.
can happen because you have gum recession, and that can happen if you're being over aggressive with your toothbrushing, or there's lots of different factors that can affect that. Some people can just generally have more sensitive teeth. It doesn't necessarily mean there's anything untoward going on, but it's very important that you see the dentist to eliminate sort of the other causes that might be it. Some people might just have sensitive teeth, or if there's another cause for it, it could be tooth decay, it could be gum recession, it could be a crack in one of the teeth. So it's very important that you see the dentist to eliminate or try and minimize the likelihood of any of those things, so that if it's sensitivity, there's lots of different things to manage it.
And that's really good to know. Thank you. Just going back to the fertility and oral health aspect, if there is then something in there, does it matter whether, say, they are pregnant or whether they are trying to conceive? The length of time or the tools available to reverse or remedy if there is, say, an infection.
So the treatment would usually be very similar, but
Yeah.
the effects can obviously be quite different. So if there's
Mm.
active infection affecting the gums, if there's periodontitis, it can reduce your chances of conceiving. If you
Mhm.
are pregnant, it can actually, there's some research to show that it can even increase the likelihood of getting pregnancy related complications. So things like gestational diabetes, preeclampsia, preterm labor. They even found some bacteria from the mouth, like we said before, in the placenta when if there was preterm birth or low weight at birth. They found that women who had gum disease would usually have this bacteria. So they have actually isolated this bacteria from the placenta.
So what could be done in that case?
So seeing the dentist
Yeah.
and cleaning the gums really well,
Mm.
eliminating any risk factors, and this will usually help. So it all depends on the status of the disease, whether it's early stages, moderate or severe. But generally, the treatment would be deep cleaning of the gums to get rid of anything that's causing the gum disease. It would usually be poor oral health in combination with other factors. So it could be smoking, it could be clenching your teeth, it could be stress, it could be malnutrition. So it's addressing all of these factors once they've been identified, and then slowly working with your dentist or dental hygienist to come back to a more stable position of the gums. Like I said, you can't reverse the damage that's been done, but you can stabilize the disease and stop it getting worse. So it's very important to treat it as early as possible.
Yeah, and I think that's key, and that's something that a lot of people, they'll put off because it won't be hurting them yet. And I think that it's once it gets to the point of pain, that's when it's like maybe slightly a bit too late, or you're like, oh, you're getting into danger zone now.
Yeah.
And so many people forget to go to the dentist for their
Yeah,
checkup.
exactly. Yeah.
Um,
Unfortunately, when you get to that stage, it's often too late. In
yeah.
some things, the disease has already been established, and it's a lot of it's a lot like this in a lot of dental conditions. So tooth decay, you can have absolutely no pain whatsoever and have tooth decay. You can have gum disease, you can have oral cancer. There could be a number of conditions in the mouth without any signs that you might feel. which is why regular dental checks are so important. And it's one of the biggest investments people can make, because the sooner you treat any disease, the better the outcome, the less complicated the treatment usually. So say, for example, tooth decay. In the early stages, you could get away with a small filling. If that decay becomes more and more progressed, then it goes to the center of the tooth where the nerve is, you will need a root canal treatment, which is often more complicated to do. It's more expensive, it's more time consuming. The prognosis of the tooth then reduces. If the decay is even more established, you may need to have the tooth removed altogether. So something that could have been solved with a small filling, for example, if you leave it untreated, it can become something a lot more serious.
And that's what I find is quite telling, is that, say, the cost of somebody doing aesthetic treatments parallel to dental treatments, I think many people might not have any problem in paying to do cosmetic treatments or getting their hair done or any of these things, but actually when it might be a similar cost or less even to get your teeth done, there's some kind of barrier there. Do you think? Do you see?
We do see that a lot, and I think a lot of people would put maybe more emphasis or more efforts into their outward appearance than their inward health. But I think now, as a society, we are going more and more towards maintaining overall health, and oral health is still not quite there as much as everything else. But I think we are trying to increase awareness, and so that people are more aware of what's going on in their bodies. And there's people who are very good with exercise, they're very good with their nutrition, but they may not have seen the dentist for many years. And actually, as we've said, oral health goes a long way in your overall health. So things like diabetes, other cardiovascular conditions, they're directly related to the mouth. So it's very important that good oral health is maintained as well as overall health.
Yeah, and I think there's another thing which you introduced me to, like tongue scraping and things like that as well as part of your daily routine. Can you explain a little bit about how that works and what the benefits of doing that are?
Yeah, of course. So tongue scraping is an ancient Ayurvedic practice that's been around for centuries, and a lot of people have been doing it. It's thought to not only remove bacteria from the surface of your mouth to help with bad breath and general oral hygiene, but the Ayurveda practice, which is an ancient practice, says that it can even remove toxins from your body and help with your digestion. So they would advocate scraping your tongue first thing in the morning, even before you've had anything to eat or even drink, even before you've had any water to drink, and last thing at night to get rid of the bacteria that are on the surface of your tongue. A lot of people might know about brushing and flossing, but tongue scraping might be a relatively new practice to them. But it's very, very important, and I've introduced you to it, so I'm glad. I hope you're maintaining it and doing it slightly.
Fascinating.
But it's really satisfying once you start scraping your tongue and you see how much stuff comes off. It's actually, but it's really satisfying. And you're like, all of this has been sitting on my tongue, and it's hard not to do it once you incorporate it into your routine. It takes a few seconds to do, and it makes a huge difference in your oral health and your overall health. So like I said, there's some studies to suggest that it helps with your digestion, because digestion in general, gastro health starts in the mouth. It's the gateway to the rest of the body. And if you have excess bacteria, you have a coating on your tongue, then that might not allow you to digest your food properly. You might not even taste your food properly. And so it's very important that you are cleaning it with a dedicated tongue scraper. Some people will clean their tongue with a toothbrush, and that's not effective, and it's not hygienic, because you're just swishing around bacteria and it's just getting caught in the bristles of your toothbrush. And I personally don't like plastic tongue scrapers. I'm a big advocate for copper tongue scrapers. Copper is well known to have additional health benefits as well. And it's very long lasting, very durable, so it's worth investing in a tongue scraper kit to help maintain your oral health.
Yeah, brilliant. Well, yeah, no, I'm a big fan of it, and yeah, just from the growth factor. I'm sure the health factor too. So, could you just share what your top 5 tips would be then in terms of oral health linked to fertility, but then in general as well?
Yeah, absolutely. I think number one thing is to make sure that you have a good oral hygiene routine. And oral hygiene, like I said, brushing your teeth with an electric toothbrush twice a day, cleaning between the teeth using either floss or interdental brushes, scraping your tongue every single day. That's very, very important.
Mm-hmm.
So number one would be having a really good oral hygiene routine. Number two would be just generally looking after your health. I know that sounds really, really obvious, but overall health and oral health very closely related. So making sure you are having a nutrient-rich diet. Again, a lot of anemias and deficiencies can show up in the mouth as well as the rest of the body. A lot of people who suffer with ulcers might have deficiencies, so that will show up as ulcers in the mouth. That could be anemia or vitamin deficiencies, particularly if somebody is vegan or vegetarian. So making sure you have a good nutrient-rich diet. Seeing your dentist regularly. Again, I know it's boring and I'm probably saying the same things again and again. Seeing your dentist is so important because they can see so many things that you can't see. And like I said, it's one of the biggest investments that you can make, because the sooner you spot things, the better it will be. That was 3, wasn't it? 5?
Do you want 5? We can stick up 3.
I think with the oral hygiene, I covered 2 bonus points.
Yeah, I think, yeah, it's being aware and being proactive, I think, as well. And actually doing it and having a good routine, because sometimes you just forget.
Mm-hmm.
Like, you know.
Exactly. And it's difficult to know. So for someone, for example, going through IVF or fertility issues, you might not necessarily think of this as a link to your, reproductive health. You might not even think of it, but it's very important. And, I'm glad the research is coming out now to suggest that actually, if you are having problems conceiving, make sure you're looking after your overall health, including your oral health. Make sure you see a dentist, because if you improve your oral health, chances are you may even improve your chances of conceiving.
That's fascinating.
Something that's simple, it's not invasive, it's not anything complicated. It's relatively straightforward, and it can go a long way in helping you.
Oh, I love that. Thank you so much, Dr. Shadi. That was fascinating. And I hope everybody who's watching this now has been inspired to take better care of their teeth. I will share all of this information and more about where you can get hold of Dr. Shadi as well. And anyone who's watching this on the replay, hello to you too. Feel free to reach out if you do have any questions. But other than that, yeah, thank you all for tuning in. So fascinating. Thank you.
My pleasure. Thank you so much for having me.
Thank you. See you soon. Bye-bye.
Bye.